Good day, everyone. I am Brian, moderator for this webinar. I welcome everyone for today's webinar, How to Conduct a HIPAA High-Tech Security Risk Assessment. I would now like to introduce our presenter for today. Brian Turtle is a certified professional in CPHIT, certified HIPAA professional, certified HIPAA administrator, certified business resilience auditor, certified information system security professional with over 22 years experience in health IT and compliance consulting. I would now like to hand over the floor to the speaker. Over to you, Brad.
Thank you very much. We've had more breaches in the last couple of years of protected health information than the entire history of this regulation. 133 million individuals were affected in 23. Healthcare certainly is a big target. The most common way individuals get breached with protected health information, it's email. So why do we need to do a HIPAA security risk assessment? Again, we don't want to, you can't just use cookie cutter templates for the HIPAA security rule policies and procedures. Massive increase in breaches, consequently investigations, and specifically the number one area of non-compliance with the federal HIPAA laws is lack of a risk assessment. The HIPAA security rule, as it currently stands, now there are changes coming. When we assess risks, the current law states, conduct an accurate and thorough assessment of the potential risks and vulnerabilities to the confidentiality. It gets confusing because the government tells us what to do, but not really how to do it. There's a lot of different ways a risk assessment can be done. The very first standard is the security management process. The very first implementation specification is risk analysis. We need to find the risks, then we need to manage those risks to reasonable and appropriate levels. How does this look in a NIST-based setup? Here's the HIPAA security rule standard security management process, and then implementation specification of that standard sanction policy. Apply appropriate sanctions against those who fail to comply with our policies, obviously. Now we move to information system activity review, and this, of course, is required. Everything is going to be required in the future. Implement policies or procedures to review your information system activity. Is their system capable? Yes. First off, they have a Windows domain environment. Now we move to workforce security, administrative safeguards. Implement policies and procedures to ensure that all members of the workforce have appropriate access to health information and to prevent those who do not have access from obtaining access. In the past, when something was only addressable, we didn't necessarily have to implement it. Implement procedures to determine that the access of a workforce member, is it appropriate? Termination procedures. Do you check references and educational background? Then termination procedures. Do you have separate procedures for voluntary or involuntary? All right, now we move to information access management. So moving on, implement policies and procedures for authorizing access to protected health information. Isolating clearinghouse functions. Access authorization. Implement policies and procedures for granting access to electronic protected health information. Access establishment and modification. So implement policies and procedures that, based on the entity's access authorization policies, establish, document, review, and modify users' rights. Security awareness and training. Implement a security awareness and training program for all members of the workforce, including management. Security reminders. So security reminders, you have to do this. We have to educate the staff. Same concept with protection from malicious software from an administrative standpoint. All right, login monitoring. Procedures for monitoring login attempts and reporting discrepancies. This is sort of more an administrative, how are the passwords allocated? Security incident procedures. Implement policies and procedures to address security incidents such as a virus. We have to have a policy for responding and reporting incidents, so identify and respond to suspected or known security incidents. Now we get into contingency planning. What are we going to do if we lose access to the technology? So data backup plan. This is just obvious. In any organization, when you have sensitive data, of course, you need to back it up. Disaster recovery plan. Establish and implement as needed procedures to restore lost data. What about emergency mode operation? While you're operating, testing and revision procedures. Implement procedures for periodically testing. Same with application and data criticality. Periodically, this is going to be annually. If you are covered under HIPAA, if you're a covered entity or you are a business associate, if you outsource to an organization that is going to be privy to protected health information to do a function on your behalf, they need to sign your business associate. Physical safeguards, facility access control, while ensuring that properly authorized access is allowed. Contingency operations, this one's kind of simple. Facility security plan, implement policies and procedures that physically safeguard the facility and the equipment therein from unauthorized physical access, tampering, and theft. Access controls and validation procedures, implement procedures to control and validate a person's access to facilities based on their role or function. Maintenance records, implement policies and procedures to document repairs and modifications to the physical components of a facility which are related to security. Workstation security, physical security of the workstations. Implement policies and procedures that specify the proper functions to be performed, the manner in which those functions are to be performed, and the physical attributes. Disposal, when you dispose of old equipment. Accountability. Now, another change that's coming is we're going to have a network map and also an asset list of all the business-owned hardware. Now we get into the last leg of this, the technology. Now this is really where a lot of the big changes we're going to see in the security rules. But let's get started. Access control. Unique user ID. Emergency access procedures. Establish and implement as needed procedures to obtain necessary data during an emergency. Automatic log off. What does that need to be? It totally depends on risk. Encryption and decryption. Implement a mechanism to encrypt and decrypt PHI. What about faxing? You're going to be able to fax? Traditional faxing is entrenched in health. Integrity. Implement policies and procedures to protect PHI from improper alteration or destruction. Mechanisms to authenticate electronic protected health information. Transmission security. Implement technical security measures to guard against unauthorized access to electronic PHI that's being transmitted over an electronic communications network. Encryption in transmission is not necessarily required. Implement a mechanism to encrypt. A risk assessment is not only required, I mean, we have to do it, and we're going to have to do it annually. When was it done? Was it done in the last year? And this is very important. Assess the risks, write your policies and procedures according to the risk. All right, well, I will wrap this up. I hope you guys have a wonderful rest of the day and got some good information out of that. I know it's a lot crammed into a short amount of time, and we were certainly... Anyway, with that, I will end the session, and I hope you guys have a wonderful day ahead.